Evie Cohen, thank you very much for coming to Appian World to begin with, and then, of course, to our session here. As Alexa mentioned, we'll have a couple of hours right now focused on pharma, followed then by another session on healthcare. The couple of hours that we're going to spend here are going to be broken into two different sessions. We'll have an initial session where we have our wonderful friends from KPMG as well as Johnson & Johnson here on the stage. I'll tell you a little bit what we're going to do there in a minute. And then the next section after that, after a 15-minute break between, which we can allow you to actually stretch your legs and get some coffee, will be focused on regulatory information management and also aspects of GXP validation on the Appian platform with some experiences of folks from Sanofi, from Amgen, from Johnson & Johnson, and allowing us to have a little bit of an interaction. Some Q&A, some audience participation, if people here have other experiences or experiences that want to share or some things that we want to ask the panel, that would be great. So without further ado, I will turn to our wonderful panelists here. And we have from your left to right, Bill Bradley, Marck Aghnatios, and Rajesh Misra. Mark and Rajesh are with KPMG. Bill is with Johnson & Johnson, and he wore his wonderful Johnson & Johnson shirt. So good. Which I love and would love to actually, see if we can actually get one. But that's great. I want to tell you a little bit. I usually exercise in the mornings, and when I exercise, I like to kind of either watch the news, whatever's on the news, or go and catch up on some TED Talks. The TED Talk I saw this morning was pretty amazing. It was a pretty recent TED Talk, and it talked about communication and whether we have good tools to communicate. And the message was really the best tool we have to communicate is our brain. We actually communicate to each other in a way that allows us to actually synchronize, apparently. Go watch the TED Talk. It's really, really interesting. Synchronize our brain waves as we actually communicate. So our intent here today is going to be to try and get their brain waves to somehow sync with you guys, the audience here, so you can actually get and understand what it is we're trying to communicate. But having said that, fine. Put that science aside. Let's get right into it. So I'll start with each one providing a little bit of a background to yourself so you know who's on the panel, who's sitting here in front of you. So Bill, please.
Sure, thank you. My name is Bill Bradley. I'm with Johnson & Johnson. I've been with Johnson & Johnson about 27 years, all in the IT organization. Left IT for a brief stint and actually was in sales and marketing in the consumer sector of Johnson & Johnson. I've been doing BPMS now for about 5, maybe probably 6 years now since we first initially investigated it. We've rolled out a lot of stuff, which I'm sure Evie's questions will lead to. And for members of the audience who are on my staff, you guys now have an assignment, which is make sure I get a new picture. Okay? So thank you.
Oh, great. Excellent. And not to date us, but we actually go back quite a while. I mean, I remember doing some projects with Bill maybe 15, 16 years ago or something like that at J&J. So he still has a lot of hair. I've lost mine. So
and I was painting last night. This is not gray. It's all paint. I was with that artist guy there.
Good. So wonderful. Next, we have Mark here. Mark is a director of technical enablement in the New York office of KPMG. Please,
Thanks, Evie. So Marck Aghnatios, I'm based out of New York City office. I've been with the firm for just about 16 years. Really, during that time, focused a lot on technology enablement, process and process automation, and the last few years, specifically supporting and working with Appian, the Appian platform as well, and delivering some of those capabilities to our clients in the pharmaceuticals industry.
Wonderful, thank you. And Rajesh. Rajesh is a partner with KPMG, and again, nobody could probably tell the audience better about yourself than yourself, so please.
Thanks, Evie. My name is Rajesh Misra. I'm partner in Life Sciences Advisory. After some time, we stopped saying that how many years, but just it's easier for you to know. 20 plus years, last 16 plus years, I'm with KPMG. Been doing life sciences. Basically, I work in compliance space. That's why this topic is I'm very passionate about this topic and everything that we are doing. Basically, my focus is looking at what we call it technology compliance. So compliance and bringing technical solutions to address compliance. That's why how fast can we do the submission, how best you can be compliant at a most effective way. So those are the things that we are doing, and very happy, very excited to be with you, spend 45 minutes and exchange our experience and ideas. Thanks, Avi.
Wonderful. The way we're going to run it, I have prepared some questions that I thought would be interesting for all of us to hear. I'll be posing them to the individuals in turn, so we'll start with Bill, then go to Mark, and then to Rajesh. And then after that, we'll definitely leave some time for Q&A from the audience. The session is being recorded behind you, so be careful with the questions, but that's good. So, Bill, I know we worked together for a while, and one of the things that always struck me in general, but also with working with a system integrator as well as looking at a platform like Appian or any platform that you work, how do you pick that right first project to work within, and what are some suggestions you might give to somebody who's actually just starting that path right now to look at how do you actually evaluate? Are you going to go with a full-fledged enterprise-wide project, or do you want to pick a specific area, and what makes for that specific good area to start with?
Okay. Just to give a little background on Johnson & Johnson and what my role is and how it's evolved. Johnson & Johnson is about 240 or so different operating companies. And each one of those operating companies are all independent, truly independent, and they basically do what they want. We consolidated IT into one organization, sort of like its own internal consulting company to all the 200 plus Johnson & Johnson companies. So the strategy or the vision that I had when we first started BPMS and how we selected our first project was we didn't do a build it and they will come. What we did was we went out and looked for something internally within IT, within information technology application services. Application services is about 450 or so IT professionals who are Johnson & Johnson employees and about 4,000 contractors. And we had to take all the orders into one central area so that we would know what's being worked on, where it's being worked on, how much is it costing, et cetera. So that what we did and the strategy that I had with other members of my team was instead of trying to go and find I'm going to use the term, a business project, we looked internally to ourselves. What could we do for ourselves to make ourselves more efficient internally? And we had a grandiose strategy, which I'm happy to say 4 years later is completely realized. But we started very small of a huge process, and we picked what we believed was the bottleneck, which was getting projects approved and funded. So we started with just that piece of the project, and an SOW, a statement of work, what does it cost, who's going to pay for it, how are we going to recover the money, and how do we get it approved? So that was, as I'm sure most of you have experienced, who has it, where is it, who's approved it, has it bounced around, what's the cost, et cetera. So we chose that, and that was our start. So we started that, and now we have a complete end-to-end. I can tell you with today's system where the time a request comes in, all the billing information that's in Ariba, because we're hooked to Ariba, all the information that's hooked to Instantis or Clarity, because we're hooked to that, all the information that we feed to our financial systems out of it. So end-to-end by our records, I can tell you anything. You tell me the request number, you tell me the SOW number, we can tell you end-to-end. Now, as far as the project that we're going to do enterprise-wide, because we just launched late last year, BPMS as a service, by having IT use the tool, I got all the IT people excited and really excited about it. And now when they're out at the operating companies and a solution or something comes up, we have BPMS as a service, which is run out of my group. And now IT members, when they hear an instant, they say, that's BPMS. You guys should be calling Bill's group, and they'll help you out with that. So by getting ourselves all excited about it and having IT use it, they now are, if you would, our agents in the field selling it more to the operating companies, and that's how we're getting the projects to come in. So we started very small, but with a huge strategy for ourselves. And now BPMS as a service is really starting to take off because we've done about a dozen now.
Yeah, so that's great. I mean, that leads me to the next question. But before that, I mean, I remember last year you also spoke at Appian World, and there was a picture you showed of, you know, the yarn and all the different stickies that
Yeah.
they use. I mean, it was a whole, you know, wall of process assessment that you did to actually evaluate what the process was, and then of course improve it. So it wasn't a less complex project that you guys picked, but it was a very confined scope.
Correct.
Right? So it wasn't about picking something simple that can easily done. It was still complex and heavy, but it was a very well-defined scope, and I think that may have aided in that.
And what we've done now, as far as all we've set up in Tampa, Florida, Prague, and we're in the process of doing one in Singapore and in China. We now have a central order desk for IT that's using that. So not only did we consolidate the process, now we're consolidating all the roles. So when you need IT services, you're calling, I don't want to call it a help center or a call center because it's way more than that. But that's all now consolidated too. So our business partners or anyone in J&J who wants a service calls one location depending on the region they're in, and they handle everything, and they're using this system because that's how easy we've got the complex process now down so that it's basically like order takers. Very experienced, high-tech order takers. Not, it's not ordering a pizza. It's very complex. So by the process, we're there.
Okay. So following up on that, if you now switch a little bit to focus on regulatory requirements, and obviously J&J is continuously looking for improvement in the space of how to manage regulatory information. What are some considerations from your perspective when you look at the complexity of those processes, the data sources that you need to connect to and everything, and whether BPM is really fit for that or not?
Oh, BPM is definitely fit for that. We haven't done any, truth in advertising. We haven't done GXP regulatory type of applications yet where we have 2 or 3, and Evelyn, who's in the room, can keep me honest, that are on the drawing board. And we're facing probably the situation that the industry is facing. J&J is not alone in this, and trying to get the regulatory alignment around using the cloud offering, and how do we use the cloud for GXP and still pass all the regulatory compliance issues that may come up. Right now, we're in the process of we use the Appian cloud exclusively today. We're in the process now of developing our own internal environment to try to do regulatory. We have one application like I said, that we're really deep into trying to get that one done. But as far as other data sources that we've linked to that are maybe SOX compliance and things of that nature, for example, we have a contracting system that generates the POs and the PRs in our Ariba system. So we have Appian hooked up to Ariba. We have Appian hooked up to SAP, like I mentioned. And what we've done there is we create everything in Appian. And then Appian has all the information that we need for an Ariba, which is a payment system if you don't use Ariba. I apologize. And what we do is we create the record in draft mode. We send that into Ariba, and there's about 4 or 5 other pieces of information that need to be placed on that Ariba record before you can go through the Ariba system. So by creating all that in Appian and then passing a draft record, then we do a swivel chair where the PO or PR analyst will go and they will complete that record, and then they trigger it into either, in this case, Ariba, and all the SOX compliance, all the flows, all the approvals and everything occur in Ariba, which are SOX, which is under the compliance, and that's all done there. We then use records, as Evia talked, and bring back like how much has been paid against that invoice, who was the approval, what is the cycle time. If you saw my talk last year, I know cycle time for just about anything and everything in my systems. So if you touch my system, I know about it. If you call up and say something got stuck or it's taking too long, I go right into the system, and I'm not shy about telling you who is the person it's stuck with, because I hate to say it, most of the time it's stuck with you. Vendors will call up and say, this has taken 3 weeks to get done and our SLA is 3 days. I'll look at the record and go, you're absolutely right, it's taken 3 weeks, that's horrible. Oh, by the way, J&J's side finished in a day and a half, and it's been with you for 3 weeks. So, our partners get very careful about looking in the record before they call me up to tell me that something's wrong.
That's great. That's great. So basically, the power of that information gives you the bit, and I think that the applicability onto the submission world, regulatory information, is exactly the same, right?
Right, and we are very excited to do our first one once we get our internal environment and make sure that we can meet all the regulatory requirements.
Okay. So taking a little bit of a step further up, from an overall center of excellence perspective, you've established a center of excellence at J&J for BPM, for Appian. What are some of the challenges that you encountered along the way? It's now been in place for a few years, but what are the challenges and what advice would you give to somebody that's actually looking to go in that direction, right? First, is a center of excellence, is such a governance body necessary, required, and how do you go about establishing that?
We call it BPMS, BPMS as a service. I'm not quite sure I want to call it a center of excellence or pat ourselves on the back with that type of title. We call it a business process management service. And not to, the two challenges that we have right now in doing that, one is cost, and I'll talk about cost because cost is not probably what you think when I say cost. But the second thing that we're challenged with is the regulatory stuff, with the Center of Excellence, which I already spoke about. But on the cost side, let me speak about that. It's not the cost of Appian. It's not the cost of partners. It's the cost of doing work globally. I can create a simplistic system, or let's say medium-sized system, let's say in the U.S., North America, and I'll pick a number, $125,000. And I go to my partners, and they're like, okay, it's $125,000. But now with BPMS as a service, we're building applications on a global scale. $125,000 to the CIO in Vietnam, he passes that. I mean, you can hear him fall when you tell him $125,000.
Yeah.
So the challenge for both partners that we use and ourselves internally is how do we get the cost for those applications in those markets to be cost effective. We can get this. We can certainly show ROI and reduce cycle time, speed to market. All that is off the charts, and we can prove that. But $125,000 to a Chinese CIO or one in Vietnam, et cetera, is great. And the other challenges that we have, which if some of you do work in the Brazil market, is using resources and the tax insanity. And I apologize if someone's from Brazil. I don't mean that. I don't mean that badly, but a 40%, a 35 to 42% excise tax if you don't do the work in Brazil. So now trying to get the challenge of Appian resources in Brazil to deliver on a BPMS as a service on a global basis is a challenge. So I would say the biggest challenges we have now that we've started, which is different than some people just starting, is cost, and it's not, again, not the cost of Appian or the cost of that type of stuff. And also, the regulatory that because we're trying to expand so fast now.
Okay, excellent. My last question to you, but obviously the audience will have a few later on when we have the Q&A. Describe a little bit the journey in leveraging systems integrators like KPMG, others that you work with, and how do you bring them to work within the strategy of what you guys have devised, year in, year out, at J&J.
So how do I keep them in line?
Yes,
okay.
Good question.
Okay.
How do you utilize them to the benefit and to maximize the value for everybody?
Yeah. We have a very good relationship with KPMG. I can say, the three main things that we get are consistency, we get leverageability, and we get understanding. Now, in consistency, what I mean by that is they know my business. They've been with me a while. There's a woman on staff, Jill, who if Mark or Jess or Jerry or anyone tries to take Jill from me, the only reason why Jill is not here is because she had a kid and I allowed her to take maternity leave. So Jill is fantastic. And so are other members of the staff that we've had, and we've had them for about 4 years now. But we get consistency that the KPMG people who work with us have been there a while, they know what our environment is, et cetera. That leads into the leverageability. Each time I need to do something, I don't have to explain the J&J world, which is quite complex. 200 operating companies acting independently. I don't need to explain to a new person coming in that, like, we've already hooked up to Ariba, we've already hooked up to, for single sign on our Active Directory. All that is assumed and known, and we're down the road and we're moving fast, so we have that. And the last is understanding, as I mentioned, about not only the company, but of my style and the style of my team, the style of what we're trying to accomplish. I don't know if you guys walked around the museum last night. There was a jackrabbit, and they said the jackrabbit can get to 0 to 35 miles an hour, like in something insane. And KPMG, Bill and Jill and Aghnatios, a whole bunch of other folks from KPMG, the most forefeared words that they hear from me and my staff also is they can all beat this jackrabbit fast. As if I walk in and I say, I have an idea, they are gone. I mean, they are out the door as fast as you can imagine. And the last person who I happen to catch, because I'm gonna come up with an idea, and they're going to listen to it, understand where I'm coming from, and sort of do, you spoke earlier about like the mind meld.
Yes.
But the leverageability, the understanding of the J&J, and me not having to re-educate someone over and over again on the J&J world. I mean, we've had our challenges. I mean, it goes with the territory. But it's a working relationship where I need to get something done and I need to do it really fast. They understand that, and we up and down change things around. We have, for the BPMS as a service, we have a development center in it, and we have a factory. KPMG is part of both of those things, and they've helped us move it along. So it's been a good relationship, and that's the three key things that we've done.
Wonderful. Thank you very much, Bill. We'll turn to Mark. Mark.
Yes, sir.
Online with, having just heard from Bill, what he's looking for and how he crafted the relationship with KPMG as a system integrator. As a system integrator, what are some considerations that you can see in leveraging BPM technology, BPM platform, supporting regulatory compliance requirements and some of the challenges across life sciences that all of us will actually deal with?
Yeah, so some of these come in line, obviously, with BPMS and what it provides. So some of these items, I made a few notes of them, is really first being the agility and the speed and how quickly you can actually get those items, those applications actually developed and change as you develop them. And after you deploy them, how quickly can you actually go back and change them? So that ability to be very agile, to incrementally be able to develop functionality on top of the platform and roll it out incrementally as well is extremely important, especially in a regulatory environment. We know it changes all the time, and the business requirements will evolve and change effectively. So that's one area that we think is certainly a consideration. Next is around data and process centric. So any technologies that we try to evaluate for a regulatory type initiative is it really has to have a data and a process-centric ability to actually manage and develop applications. We know data is a critical part of pharma. It's a very complex landscape. For example, J&J, as Bill indicated, there's data that comes from China. There's data that comes from Vietnam or some of the other countries. And it's not going to be all in the same format. You want an application that actually is developed and can be developed with data in mind, and certainly a process that supports a global implementation. Next, we look at integration. So that technology that you actually pick, how interoperable is it across your entire environment? So you're going to have a cocktail or slew of technology that are present, whether it's SAP, Ariba, ServiceNow, and so forth. So you want a product that actually integrates really nicely with all the applications and really is able to transact data across the way as well. Next is really specifically around audit and traceability. So we want all of these activities and transactions that actually take place within the system, as Bill indicated earlier, to be auditable and traceable. At any one point, Bill should be able to log in the application in the system, be able to track where that particular transaction that their partner says hasn't been done yet. How far has it been sitting in that queue? Why has it been sitting in that queue and is actually working on it? So that's really very important. And lastly, really, it's around reporting. So all this wealth of data that your company has captured, how do you enable your users to actually be able to, at any one point, run and pull reports against that data and meaningful reports, whether it's operation type reporting or cost specific type reporting and so forth. So you want to be able to have a platform that is agile in the sense where you're able to develop and run reports against that data that is meaningful.
Okay, thanks. I'll add a little bit further. I mean, so you know, you've heard Bill here and Bill with J&J, and you guys have worked together for a while, but it's not the only company that KPMG is working with. What are some of the challenges you actually see when you approach some of the larger life science companies that you work with as well? And obviously they work in a regulated environment. You know, what are some of the challenges you see over there, and how would you advise, you know, the interaction between a system integrator and a life science company to be able to create value for both?
Yeah.
And for patients, of course. Yes.
Yeah, of course. I think so. Some of those items with one of the first ones that comes to mind is really around the requirements and the compliance requirements. They're fragmented, so any compliance type, regulatory type initiative that you're actually trying to support, there are some standard requirements, but there's also some company-specific requirements that actually are needed to support that initiative. So being able to articulate those is one area that we see as a challenge. The evolving nature of those regulations is also another challenge. Being able to, as you actually, you know, potentially develop a solution to support that regulation, it's going to change. It will change, and you have to be able to adapt and change to that. So being able to be agile enough to understand what those requirements are, be able to translate those into the systems that you're actually implementing, and then push those changes across the way also is certainly a challenge that we see along. The other one is, you know, budgets are certainly leaner at this point, and that's an area that, you know, constantly trying to work through. What is the cost of that initiative? How quickly can you develop it? And oh, by the way, our budget now is not really what it was.
So do you see some real changes, I would say, over the last 10 years or so from that perspective? You know, patent cliffs, have been hit by many different companies. I see in pharma we are much more required to become more efficient, effective. While continuous improvement has really swept across operations, other parts of the organization, including R&D even, are now required to actually operate more efficiently. How do you manage some of those costs? What do you see as far as some trends in that area?
I mean, certainly, when it comes to IT or in technologies, focusing on platforms and technologies that actually give you the ability to be agile as a business organization, and be able to, and agility is directly associated with cost.
Okay.
So certainly having those that agile team is not just the actual technology itself, but having the team that you've actually built all along to be able to understand the regulations, be able to develop them in a way that when the technology supports it. So
it's even a culture that comes with that, right? So it's not just the agile capability, methodologies, people who run it, but even the culture of thinking that way.
Absolutely, yeah, absolutely. I think in the industry we hear a lot about agile in general, but I think a lot of times it takes a lot of culture to actually support the ability to be agile. It's not, and it's a process. It's definitely a process.
Excellent. We'll talk about a little bit of the implications there later in the next session on GXP, how to deal with agile validation versus waterfall, but we'll keep that for the later session. Thank you very much, Mark. I'll turn to Rajesh. What are some typical technology trends that you see today in life sciences, from the perspective of a system integrator that kind of sees across the different companies and what's going on out there?
I mean, I think it's a great question, and it's a much broader discussion, right? If you look at the broader technical trends, I will not go into what are the broader trends are, but I will talk more that's very relevant to this audience and also this conference. So what we call as intelligent automation. So we believe that based on everything that we are seeing today, that automation itself will not get you there. So it is a kind of, it's a story of the past. So we are looking more for intelligent automation. So that's why some of the Appian capabilities will be really good. The second trend that we see is a connected platform. So if you look at the last 3, 4, 5 years in the industry, the main driver is not the new drugs in the market. Main drivers, if you look at it, is M&A. So much of integration, so much of divestitures, the shifting of all these companies and how they work. And what it is doing is creating a bigger challenge if you are in regulatory, if you are in supply chain, if you're managing the product. All of those things, so how fast can we either divest or integrate? And those are what we call as a connected platform. So intelligent automation, connected platform, those are the two things that's very relevant for this group. And how can we make it happen? And that's what, in my mind, I think the Appian platform itself. And one other point that I will make is what Bill was pointing it out, the rabbit and it's everyone goes runs. It's not just about the idea. It's can we execute that idea? And that's a bigger trend that platform gives us the option. So you can be as smart as you want to be, but if you don't have the tools in your hand, you can't execute it. So it's the idea that's great, but do I have a platform to execute it? So now we have the platform. That's what we call as a intelligent automation. So how can we make it happen? And then we bring those things with the data analytics. So we think that data analytics is driving intelligent automation, and then we are adding a lot of these things that you are hearing from industries, cognitive, robotics process automation. So we are looking at holistically what automation looks like. Yeah.
Thank you. Have you noticed some increase in the short notice engagement? So, obviously you guys are available from the perspective, the assumption on a life science company is that KPMG or an SI always has resources available, right? It's like, if we don't have them, you guys have them, right? So, from a perspective of dealing with compliance, quick resolutions to regulatory requirements, anything like that is happening out there. Is there a change? Is there anything where you see more of these projects coming in your directions more recently?
I mean, it's a very interesting thing, and again, going back to Bill's idea, chasing the rabbit, you can see it's more, and how many of you are from regulatory compliance? I mean, is that, it's a big audience, just raise your hand so I know how much.
If you touch regulatory compliance, regulatory information management in any way.
So few of you have good sense of what challenges we see across the board. Right? I mean, the bigger thing is if you are part of reg ops or reg affairs, your business is not about fixing these applications and just worrying about the IT part. Your focus is more on how fast can I get my drug in the market. If I have approval in one country, I want to get approval in the other country. I want those processes to be executed faster and not worry about the IT part of it. So we see a lot of compliance needs that we call as a white space. And when I call white space means it's not something that you have SAPs and Oracles of the world that has a big solution that takes time for you to implement it. It's more about smaller things. And I was talking to someone yesterday, brought a very good idea that we are solving a lot of small problems with big visibility and impact. So you may have a small problem, a small kind of, but the impact is much bigger. So even if it's a small regulatory process that I need to look at it, maybe I have only 10, 15 users who are going to be impacted. But that could delay my market submission by a month. That has a huge potential. And we see that kind of requirement in the market. That's where the best case solution is that I can do it very easily. I have only 50 users, and I don't have a big solution that will take 9, 10 months, 12 months to implement it. That in my mind is that we see more and more of that kind of work coming up, address my problem in a very short time frame.
Okay, excellent. Excellent. My last question to you, and then we're going to turn it to the audience. We just started talking about regulatory operations, regulatory management, information management. I think regulatory information management is coming to the forefront for many, many companies. It used to be almost considered like a back office function where, it's just a matter of, collecting the information and then submitting it to the agency and getting information back and forth. But, RIM is actually being considered much more of a strategic part of an organization today. Having said that, where do you see some of the challenges that pharma is facing now from the perspective of the move of RIM into that strategic place, and how do you guys support some of the companies in that regard?
So given that we have very limited audience focused on RIM side, I'll try to keep it a little bit high level, right? So if you look at the RIM space itself, and again, it's more driven by the business. It's not about just can I build some cool apps. It's more driven by the business. If you ask anyone who is in commercial or in R&D support, the bigger focus is time to market. And if you look at traditionally what pharma companies have been doing is a lot of siloed applications. So I may have a document management system, I may have a repository for this, I may have submission tracking, I may have archiving. So you have a list of solutions. And then what that means for a pharma company is that now you have to maintain a documentum expertise, you have to maintain, you name it. You have 20 systems, you have to have those kind of skills. Market is shifting towards, and that's what we see, that there's no single solution that can meet all these requirements. So you have that gap in the landscape itself. And that creates an opportunity for someone to put a layer on top of it. And that could be easy and something that can be done easily. But that's the bigger thing. If you look at the RIM space itself, that's why we see a lot of requirement and demand, not just about replacing everything that they have, but more about let's take a look at it. What are my gaps? How can I fulfill those needs without ripping everything and putting a new system? So that's a new trend, that can I put a veneer on top of what I have, maximize my investment that I made in different siloed applications, and take advantage of some of the new things that we can see.
Thank you very much. Okay, so I'll turn it to the audience. We have another 5 or so minutes before we take our break. Any questions directly from the audience? Just raise your hand if you have something, if you take a couple of minutes to think. And in the meantime, yes, please. Michael, yes. Okay, so everybody heard the question, or shall I repeat it? Okay. So Bill, Bill start, and then we'll.
I've already answered all of them.
Good. Okay, Rajesh, go ahead, please.
So your question is, and I will not get into the Viva part because that's not appropriate for me to talk. But my point is cloud, how cloud is being adopted, and you saw Bill's story, and you can talk to everyone else. We see a significant shift towards cloud across the board. And 3-4 years back, that was not the case. And we have been involved with so many other clients where, whether AWS environment is validated, not validated, what are the protocols, what can be validated. A lot of questions on security, data privacy, what can be moved, how should I move it. But in general, that kind of concern is going away. Viva is one of on the forefront. They have been doing it, and basically they were very smart. They started with commercial. So now the sales guys were comfortable, and they start pushing everyone else. So I think it's much better adoption. Now we see even contracting. We see pricing application. Even we see government pricing. Those are the things that are also moving in a kind of semi-cloud, not like 100% public cloud, but it's more private cloud. They are working on some shared environment and all that. So shift is there. It is much faster than what we saw. The rate of adoption has exponentially is growing very fast. So I think that's, and everyone, the question is going to be, why not cloud before you go for something else?
So good. So I definitely want to thank the wonderful panel. Rajesh, thank you very much. Mark, wonderful. And Bill for taking center stage here. Really appreciate it. A round of applause. We're going to take a 15-minute break and come back in here.